Hey guys, and welcome to the first video of the musculoskeletal system. In this video, we're going to talk about the anatomy of pectoral, scapular, and shoulder regions. We're going to start off talking about the bones, and then we're going to build up on that and talk about the ligaments and joints. And then we will end up talking about the muscles, their function, innervation, and blood supply. So the first bone we have today is the clavicle, or what we guys call it the collarbone. So basically this is your clavicle. The clavicle has two ends, one end here and one end there. And it has two surfaces and it has two borders. Alright, so the first end we have is the sternal end, which is basically the part that faces your sternum. And then the other end is the acromial end, all right? So this is the one that faces the acromial process of the scapula, and we're going to talk about the scapula in a while. So how would you differentiate between them? If you look at the one that has prismatic in shape, all right? So it is buffier one. It is prismatic in shape, okay? This is the sternal end. All right, and then the clavicular is the flattened one. So whenever you hold the clavicle, make sure that the one that is prismatic in shape, all right, it's gonna be the part that faces the sternum. Okay, so this is the mandible and this is the sternum, and then the other end is flattened. All right, so it's gonna be flattened, and this is the part that's gonna face the acromial process. Now we have superior and inferior surfaces. Okay, so the superior surface is smooth surface because we don't have attachments on the top, and the inferior surface is rough because we have attachment for ligaments and muscle. Now, what are the ligaments that are attached to the clavicle? We're going to talk about that as we proceed, but we have ligaments attached to the clavicle at the sternal end, and we also have ligaments attached to the clavicle at the acromial end. Now, I'm not going to talk about the ligaments now. The only part of them I need to talk about is what we call the coracoclavicular ligament. Why do I need to mention it? Because at the acromial end, we have rough surface down, and that rough surface, it has two parts, and these two parts are actually for attachment of the two parts of the coracoclavicular ligament. So if you guys look at this, you can see that this is the coracoid process and this is the clavicle. And out of that, you have what we call the coracoclavicular ligament. So basically, coracoclavicular is a ligament that attaches the coracoid to the clavicle. It has two parts. A part that is attached to the conoid process and a part that is attached to the trapezoid process. So if you guys look at this end, the acromial end, you will find a cone-like elevation. Cone-like, looks like a cone. Okay, so that's why we call it conoid. Conoid, it's a cone-like. Oid means like. And a trapezoid that looks like the trapezium. And this is because it looks like it. So this is the trapezoid line, all right? And out of that, we have the trapezoid ligament and conoid ligament, which are both of them two parts of the coracoclavicular ligament. All right, so this is the coracoid process of the scapula, and this is the clavicular, the acromial end of the clavicle. It has a cone-like elevation and trapezoid-like kind of rough surface, and this is the conoid tubercle, and this is the trapezoid line. So the trapezoid is going to be for the attachment of the trapezoid ligament, and this is for the conoid, and these ligaments are basically two parts of the coracoclavicular ligament. That's why the acromial end of the clavicle is rough surface. Now, if you look at the middle part of the clavicle, it's going to also be rough because that gives the attachment of the subclavius muscle. And subclavius muscle is basically a small muscle that it is attaching the middle part of the clavicle to the first rib. All right, so this is why the middle part also of the inferior surface of the clavicle is rough. We also have here the sternoclavicular ligament. We're going to talk about the ligament as we proceed, but this is what makes the clavicle medially has a rough surface in the center and also in the lateral aspect of it. However, the superior surface of the clavicle is smooth. All right, so as for now, we talked about the clavicle. We knew that this is the sternal end and this is the acromial end. All right, and we have two surfaces, superior smooth surface and inferior surface, which is rough. All right, and then we need to know that we have anterior border and posterior border. And how is the anterior border look like? It's basically we have 2/3, medial 2/3 and lateral 1/3. The medial 2/3 is convex anteriorly, so all the way until here we have the convex medial 2 border, and we have convex posteriorly, or concave, we can say it concave, lateral 1/3. And the reason why we have the anterior 2/3, the anterior the medial 2/3 of the clavicle convex anteriorly is that because we have structures passing through the passing from the neck, and they want to reach the axilla, so we need to have a space between the clavicle and the first rib so that those structures can come all the way down from the root of the neck all the way to the axillary region. All right, so if you guys look at this picture, you will see that the anterior 2/3 is convex anteriorly because we want to give space between the clavicle and the first rib for those vessels to the axillary vessels and the lower parts of the brachial plexus to get out of the neck region and reach the axillary region. All right, so this is why the medial 2/3 is convex and the lateral 1/3 is concave, because we need to this bone to go all the way back and get connected with the acromial process to make what we call the acromioclavicular joint. All right, so at the end of the day, we want the bone to come back and make connection here at the acromioclavicular joint. So that's why the anterior 2/3 is convex and the medial 2/3 and the lateral 1/3 is concave. All right, in the clavicle bone. Now, what is important clinical note we need to know? We need to know that most of the clavicular fractures, it happens in the middle third of the clavicle. So this is very important information. At 80% approximately of the clavicular fracture happens in the middle third. All right, and what kind of injury can we get in the clavicle? The direct blow, if someone hits someone directly on the clavicle, you can get fracture. If someone fall on the shoulder, he can get a fracture. And also if someone falls on outstretched arm, that can also cause clavicular fracture. All right, so these are the types of injury, and this is the most common fracture. And when we get a fracture in the humerus, in the clavicle, in the middle third, what's going to happen is, if you look at the clavicle itself, you will find that the medial part or the proximal fragment or the proximal part of the bone is going to move superiorly. The lateral half or the distal half is going to move down, and the humerus is going to be pulled medially. Why the clavicle medial part is going to be pulled up? Because here we have the attachment of sternocleidomastoid muscle, which is going to pull the muscle up. So that will bring it up, all right? And what's going to happen for the distal one half? So the distal half will move down because of the pulling of the gravity. And what about the proximal end, proximal part of the humerus? We're going to talk about that as we proceed, but we have an important muscle here called pectoralis major muscle, and that muscle goes all the way attached to the clavicle to the sternum and costal cartilages, and it is attached to the lateral lip of bicipital groove. So this muscle is gonna basically pull the proximal part of the humerus, or the humerus in general, medially. All right, so it's very important you know each part of those bones, where does it move in case of clavicular fracture. All right, now the next bone we have is the scapula. All right, so the scapula, guys, in the scapula, it's that bone that is at the dorsal aspect of the thorax, and it has three borders. It has superior, medial, and lateral borders. It has three angles. It has superior angle, inferior angle, and lateral angle. And the lateral angle, you guys, is the same as the head of the scapula, and it's also the glenoid process itself. All right, so the glenoid is also the lateral angle of the scapula. We can call it any of these three. All right, and then we have surfaces. We have ventral surface, which is where you can have the subscapularis muscle, because this is what we call subscapular fossa. And you have posterior surface, and that posterior surface is divided by the spine of the scapula into two fossae, one superior and one inferior. So that one is what we call the supraspinous fossa, and this is what we call the infraspinous fossa. So the supraspinous fossa is going to accommodate the supraspinatus muscle. The infraspinous fossa is going to accommodate the infraspinatus muscle, and the subscapular fossa is going to accommodate the subscapularis. And sub means below, so that's why we call it subscapular. Supra means above, and infra means below the spine, so we call it supraspinatus and infraspinatus, but this is subscapularis because this is below the whole scapula. It's not related to spine. All right, now if you guys look at the superior border, you're gonna find a notch and on the top of the scapula. So that notch is what we call the suprascapular notch. So you have a notch on top of the scapula, so we call it suprascapular notch. And that notch, you guys, is sealed off and closed off by a transverse ligament. And because that transverse ligament is there on top of the scapula, we call it the transverse scapular ligament. So whenever we have a transverse scapular ligament on top of a notch, it's gonna convert the notch into foramen. So once we have the transverse scapular ligament, we're gonna convert the suprascapular notch into suprascapular foramen. And that is important because here we want to protect an important nerve that comes out all the way from there. I don't want to say what is there now. We're gonna say it later on. And that nerve will come all the way to supply the supraspinatus and infraspinatus muscle. And this nerve runs in the suprascapular foramen. So this is what we call suprascapular nerve. All right, so the suprascapular nerve runs inside the suprascapular foramen, and that one's trying to reach the supraspinatus and infraspinatus muscle. So here we covered already the innervation of supraspinatus and infraspinatus. Now what about the vessels? The vessels will run on top of the foramen. They don't need support. So the suprascapular artery and vein, they're gonna come all the way with the nerve, but they are not going to pass through the foramen. All right, guys? What about the processes? So the processes in the scapula is, we have a process on top, we have a process here. So the process that is on top, we call it the acromial process. Acromial in Latin, you guys, means highest point. So if you look at the scapula, you will find that this is the highest point that you have in the whole bone. So that's why they decided to call it acromial process. Acromial process is, if you trace the spine, you go all the way until you reach the highest point, and then you will find that this whole process is a highest point, so you call it acromial process. And the coracoid means the peak, all right? So coracoid, it is exactly looks like the peak of a cook. So that is what we call the coracoid. All right, so it looks like the peak. So these are the two processes that we have them in the scapula, spinous spine. We have the acromial process. We have the coracoid process. So we have three processes. We have superior border, lateral border, medial border. We have anterior surface and posterior surface, and we have three angles: superior, lateral at the head, and inferior angle. All right, so if you want to look at this, you will find that this is the superior angle, this is the inferior, this is the lateral, and the lateral angle is exactly the glenoid. All right, and then also the head. Okay, and after the glenoid, you have here the glenoid cavity, and if you follow it, you will find a constriction, and that constriction is what we call the neck of the scapula. All right, and the glenoid cavity is actually where you're gonna receive the head of the humerus, and we have an important ligament fibrous structure, and this is what we call the glenoid labrum. And the glenoid labrum is important because it's gonna deepen the glenoid fossa to make it more to improve the congruency of the head of the humerus into the glenoid fossa. All right, all right. And now, so this is here what I wanted to show you, that the suprascapular nerve, it runs in the suprascapular foramen inside, and then the suprascapular artery goes on top of it, and they go all the way to supply the supraspinatus and infraspinatus muscles.